Hello, we will be now studying about the bone humerus. This is a long bone, which is one of the longest bone of the upper limb, having two ends and a shaft. It is a bone of the arm, and for side determination, the end which is containing a rounded appearance, which is the head, should lie above. The bone should not be held like this. So the head should be always above, and this head is directed upwards, backwards and medially. Similarly, this is lesser tubercle. This lesser tubercle should face anteriorly, and this fossa, which is called as olecranon fossa, should be present posteriorly at the inferior end. With this, I can say that this belongs to right side. I repeat, the head is present above and is directed upwards, backwards and medially. Lesser tubercle should face anteriorly. Olecranon fossa should be present posteriorly at the inferior end. Now coming to its general features, I will describe in this part only with the upper end, and in the part 2 the rest of the shaft and the lower end. The upper end consists of this one, which is the head. Here you see this is the head, which articulates with glenoid cavity of the scapula to form glenohumeral joint or shoulder joint, and it is covered by male type of the articular cartilage. Here you are seeing this constriction, the immediately constricted portion underneath the head, this is called as the anatomical neck of the humerus. This is called anatomical neck of the humerus. This anatomical neck receives the attachment of the fibrous capsule. Like this, it is receiving the attachment of the fibrous capsule here, except at this beginning here. Here you are seeing this one, this groove. This is intertubercular sulcus. This is lesser tubercle, this is greater tubercle. So in between there is a sulcus which transmits the long head of the biceps in it. Since it has to allow the passage of the long head of the biceps muscle, at the beginning of this intertubercular sulcus, the fibrous capsule is not attached, leaving a gap so that the long head of the biceps passes downwards through it. And that capsule here, the dotted appearance I have seen, it is not extending that, it is not attached to the fibrous capsule, it is extending downwards anteromedially for about 1 centimeter. Okay. This is about the anatomical neck. Now when I have talked about anatomical neck, I want to say one more neck, this one, that means the junction between the upper end and shaft. If I say this is shaft, this is upper end, so this junction between upper end and the shaft is called as surgical neck. Here it is called as surgical neck, this region, and this surgical neck is related to axillary nerve and anterior and posterior circumflex humeral vessels. Okay. We have one more neck inside, that is, if you take a longitudinal section of the bone, there is a color demarcation between epiphyseal end, epiphysis and the diaphysis, and that junction we call it as morphological neck. So we have three necks in humerus: anatomical neck, constriction below the head, giving attachment to fibrous capsule; surgical neck, junction between the upper end and shaft, related to axillary nerve and anterior and posterior circumflex humeral vessels; morphological neck, junction between the epiphysis seen in the interior of the bone. Now, after this, now this one is lesser tubercle muscle, lesser tubercle. It forms an example of traction epiphysis because it is giving insertion to a muscle called subscapularis. So this blue one here, this is lesser tubercle and this one is subscapularis muscle. This lesser tubercle is produced by the pull of that muscle, hence forming an example of traction type of epiphysis. And similarly, this tubercle, what you are seeing, this completely, it is greater tubercle. This greater tubercle have three impressions. Where I am putting my finger here, this is upper impression or anterior impression. This is middle impression or posterior middle impression, and this one is posterior impression or inferior impression. I repeat, upper or anterior impression, middle impression, posterior impression. So this upper impression is this one, and that receives the attachment of supraspinatus muscle. Supraspinatus. Similarly, the middle impression, so this one is upper impression, supraspinatus. The middle impression is this one, which is receiving the insertion of infraspinatus, and this one is a lower impression, this is receiving the insertion of teres minor. So this subscapularis together with supraspinatus, infraspinatus and teres minor are called as rotator cuff muscles. I repeat, subscapularis, which is inserted to the lesser tubercle, and this sit muscle, supraspinatus, infraspinatus and teres minor, which is inserted respectively to upper impression, middle impression and lower impression of greater tubercle. All these four muscles together we call it as rotator cuff muscles. Now coming to this groove here, in between this lesser tubercle and this greater tubercle, you see there is a groove, this one, which is called as bicipital groove or intertubercular sulcus. It is called as bicipital groove or intertubercular sulcus. Why it is called bicipital groove? Because it is traversed by long head of biceps muscle. The long head of biceps muscle passes through it. But the floor of this intertubercular sulcus or bicipital groove, it receives the insertion of a muscle called latissimus dorsi. The floor of the intertubercular sulcus, insertion of latissimus dorsi. To the lateral lip of the intertubercular sulcus here, to the lateral lip, it is the insertion of a muscle called pectoralis major. To the medial lip of the intertubercular sulcus here, it is a muscle called teres major insertion. I repeat, latissimus dorsi lying between pectoralis major laterally and teres major medially. A lady between two majors. The lady is considered as latissimus dorsi and the two majors are lateral lip pectoralis major, medial lip teres major. And the contents of this intertubercular sulcus, we can say that it is long head of the biceps as well as an artery arising from the anterior circumflex humeral artery going upwards. So, ascending branch of anterior circumflex humeral artery. The contents of the intertubercular sulcus are long head of biceps muscle and ascending branch of anterior circumflex humeral artery. This is all about the upper end of the humerus. In the next class, I will be taking about the shaft and the lower end. Thank you.